Hi everyone, this is Dr. Heather Austin Robillard again, and today's lecture video is going to go over the process of clinical interviews. What we will be focusing on in regards to what you will be tested on in the ICRC licensing exam, if you want to become a licensed chemical dependency counselor, includes the following tasks, knowledge, and skills. We will be focusing on the best practices on the use of interviewing techniques, how to build trust and rapport with your clients, utilize specific interview techniques, and the overall interview process, including its objectives and techniques. So again, to review, the assessment is a problem-solving and question and answer exercise. We are culminating this in a report that reflects the thinking about the specific case. The first part is, what is the question we are trying to answer? So the purpose of the evaluation. We've gone over that part. Now it's, how do you go about answering this question? What information do you need and how do you get that information? So this middle section, we're going to go over specifically interviews. This is what we will cover in this lecture video. Another review is that the method of gathering information is through direct communication with your client, and this also involves reciprocal exchange from them. So it can take form in face-to-face interviews, phone interviews, or video conferencing. I do think the best way to do it is face-to-face or video conferencing, so you can pick up on any nonverbal behaviors. In an interview, you can have any people involved. That can be the client versus the family. It can be the probation officer versus a third-party person. It can take place in a structured or a semi-structured or even a very unstructured pace. So this includes some pros and cons to each of them. It can determine how standardized it is, how objective it can be for each individual, whether it's free of error, as well as not feeling robotic and being able to build rapport with your client. This is how the TCU brief intake interview is set up, is more of a structured format. In an interview, the interviewer is actually a tool. They cannot be completely objective, but this can actually have some pros and cons to it. It's very important to develop trust and rapport at the very beginning, as well as continued on throughout the session. The client needs to be comfortable with you in order to share vulnerable information. Remember that the interview is about gathering information. It's not about conducting treatment or therapy. Again, some notes before we start. As I've said, the goal is to collect information and not to do therapy. However, most of your readings are more based on doing counseling, so they may not all apply to this specific situation, but some of the techniques are really helpful when interviewing individuals. The idea is that we want you to become good at interviewing and efficient at it, because this is a skill that is needed within substance abuse evaluations, but could also be valuable to you in other forms of interaction with individuals. So first, let's talk about the different stages of a clinical interview. Obviously, the first stage is introduction and the opening. Then we have the body of the interview, as well as the closing and the termination of the interview. In the introduction and the opening stages of the interview, it's very important to put the patient at ease so they don't feel like they're in trouble or they're being there's like an intervention going on, and continue to build the relationship. In the body, or the content portion of the interview, the whole point is to elicit information, continue to maintain rapport, and try to maintain control or structure of the session. This will allow you to build on their story, understand their strengths, as well as the goals for the client. And in the closing or termination, we are bringing closure, which, if you remember from the nonverbal and verbal communication lecture video, it talks about summarization. This might be a good point to kind of summarize everything that you've learned within the interview. Here's kind of a more specific breakdown of the sections of the interview and the assessment, or the substance abuse assessment. In the introduction and opening, you're going to provide introductions, maybe talk about your qualifications for interviewing them for this or assessing them, as well as establishing rapport and opening kind of a collaborative framework with them. using that attending behavior discussed in the previous lecture, as well as the listening skills of ORS. And then also identifying any behavioral observation. This might include recognizing whether they seem jittery or they came in with like good hygiene, or if they were really messy, if they're stuttering or not understanding the questions correctly. These are all behavioral observations that you would start to recognize in the introduction of the interview. Another part that needs to take place before the body or the information collection stage is informed consent and procedures. You want to explain the purpose to the client, as well as their rights and limitations to like confidentiality, which was discussed in ethics, and explain the informed consent, as well as have them sign the informed consent. And then in the body or the information collection, it's important that you continue to maintain control, not let them get off on tangents, maintain rapport with them. Again, it is important for you to be gathering information during this time rather than focusing on treatment. This can also include interviews or tests that they're conducting, like the assessment test, like the audit, DAST, anything like that, as well as continuing to gather behavioral information. Maybe you can tell that they're looking in different ways or they're being vague about something. These are all behavioral observations you can acquire during your interview process. And then in the closing and termination section, you want to answer any questions that the client may have, clarify any information that might be confusing, as well as schedule the next session, whether this is another session for assessment, or whether they're going to begin treatment with you, scheduling that session, or any other next steps, like, okay, I'll have your substance abuse assessment within 2 weeks. That kind of information will happen at the end of the session. Now, these next few slides are going to focus on the introduction and opening section of the interview. As discussed, we're going to focus on establishing rapport, creating a collaborative relationship with the client, and utilizing those interview techniques that were discussed in the nonverbal and verbal communication section. So some of the things that will take place during this stage is scheduling a mutually agreed upon meeting time, introducing yourself, being congruent, and having a positive regard, identifying how the client can be addressed. So again, this may be through pronouns, what pronouns they use, or maybe just if they go by that nickname or go by a nickname or a middle name, how do they want to be referred to? This could be a good time to engage in small talk, maybe the weather, how is the drive here, just establishing rapport and empathy. And then direct client to appropriate seat, or let the client choose which seat they're going to be sitting in. 6 through 9 will be focused on in the informed consent section. We also will talk about clarifying time limits as needed. For example, this is a 60-minute session, or this will take about 60 to 90 minutes, just giving them an idea of what to expect. And then as you transition into the informed consent, you're continuing to build rapport through non-directive listening. You're focusing on the client's views of their life and problems using open-ended questions and gentle prompting. You're providing a structure and support if necessary, using feeling reflections, clarifying the purpose of the opening stage, as well as narrowing the focus of opening questions. Then you're going to evaluate how the interview is proceeding and think about what approaches might be best used and be effective during the body or the collection of the information. You can do this using paraphrasing, summarization, role induction, or therapeutic questioning, which are all found in your readings. Some individuals have an intake sheet. This is usually given at the same time and is a form that contains most of the basic information, demographic information that the interviewer can use, maybe contact information. An example will be located in Blackboard for you, but you can also identify what you need on your intake form that fits for you and your practice or agency. The next few slides will primarily focus on the informed consent and the procedural steps of the clinical interview. As mentioned before, in this stage, we will explain the purpose of this assessment or interview, explain the rights that the clients have, including confidentiality and its limitations, Explain the informed consent, which also includes the confidentiality, and have them sign the informed consent. It's very important that they sign the informed consent before you begin the gathering of data collection. As discussed in the ethics lecture, let's talk about the rights that the clients have when it comes to informed consent. Test takers have the right to know why they're being evaluated, whether that's because the probation officer has referred them, it's a custody agreement, or they've decided to engage in it on their own, how the test data will be used, and what, if any, information will be released to anybody and to whom. This should all be laid out in the informed consent. This needs to happen at the very beginning of that interaction that you have with the client. When it comes to the rights that they have in the informed consent, test takers have the right to have an informed consent in a language that they can understand. They need to know why they're being evaluated and how the test data will be used, what information will be released to other people, and the specific evaluation procedures. For example, I will talk to them about, oh, okay, your substance abuse assessment will take about an hour and a half of us gathering and talking and interviewing, and then it'll take me about an hour to actually, or a couple days to formulate the substance abuse assessment before I will send it to you or the agency that is requesting one. The informed consent will also list out the confidentiality as well as the limits to that, examples of duty to warn or mandated reporters. Next, we will focus on what is going to be happening in the body of the interview or the collecting of the information. In the body, it is important that your role is to maintain control and maintain report, and then you're gathering all the information that you need to write an appropriate assessment. This is also a time to notice behavioral observation, which is important why you're not just like looking down at the paper and interviewing them. In the body of the interview, you will focus on a few different tasks. You will transition from non-directive listening to more directive listening. So this is going to be more direct, asking them questions or looking for specific things that insights from the client. You are gathering information using open and closed questions, which was discussed about in the reading as well as the last lecture video. You're obtaining diagnostic information used for the DSM-5 or the ICD-10. You're collecting information that is relevant to potential intervention and placement, or that ASAM criteria discussed in previous lectures. Shift from information gathering or intervention to preparation for the closing. This is acknowledging that time is passing or the interview is coming to a close and explaining and discussing the need to summarize major issues. This leads us to closing and termination and what's expected during this stage of the assessment process. You will reassure and support the client using feeling reflections, validation of the client's feelings, openly appreciating the client's ability to express emotions and be vulnerable with you. And then you will guide and empower your client using questions or asking the client for comments and questions of you. Tying up loose ends, including questions, clarifications, collaboratively scheduling the next appointment. You can use some other tasks listed here, but they're not necessarily essential for assessment and evaluation. These would likely be more important if you were conducting therapy after this process. This ends the lecture on the clinical interview process. Please make sure you're reading over any of the examples discussed and located on Blackboard, as well as reading your required readings to get more information about these techniques.